Dr. Magarelli, I have a question about men. So in Chinese medicine, we say it takes two to make a baby. Often we see the women, even when the diagnosis is male factor fertility. There's been some recent papers in the Lancet that the health of the sperm can impact the placenta health. A reproductive urologist, Dr. Paul Turek, often says that male fertility is the canary in the mine. It can let us know that there could be other health issues related to the male, so we shouldn't just go always right to ICSI and look at the men's health in general. The question I have for you is, in your practice, do the men matter? Are you interested in their diet, lifestyle, supplements, acupuncture, antioxidants in the health of the child? Because you talked about, we call it the healthy baby approach. You said healthy body, fertile body. In our clinic, we say healthy baby equals healthy egg plus healthy sperm plus healthy uterine environment. Can you share a little bit about the data, the evidence around men contributing to the health blueprint of this child, and what your thoughts are with respect to men?
I think my motto is a little more catchy than yours. Yours is way too long.
Yeah, you're right.
So every male in our practice gets the same amount of information regarding the nutritional and lifestyle impact on reproduction. Men have are actually the canary in the mine, but you have to understand that the sperm's response to the environment is delayed about 3 months. So of any group that can get the major benefit of lifestyle changes, it's the male. Unlike the female, where you're losing approximately 1,000 eggs every month, and those eggs have been with you since before birth, a male is producing 1,000 sperm per heartbeat. So that brand new cell can be very rapidly improved by simple modification of lifestyle and the addition of nutraceuticals like a good multivitamin, Conception XR, Mega Man multivitamins from GNC, adding a really good antioxidant, CoQ10 or ubiquinol, adding a very high level of vitamin D3, and avoiding alcohol, tobacco, street drugs. And in some cases, heat can make a big impact. So if they can avoid jacuzzis, that would be also beneficial. Now, I have challenged the acupuncture community because I firmly believe that we need to, much like Dr. Diane and I did with pregnancy and IVF, we need to validate the Chinese medicine's approach to that lifestyle change and show, in terms of sperm analysis as well as DNA fragmentation, that these lifestyle changes will impact the quality of the sperm. So, for example, Western medicine has looked at smoking on DNA fragmentation of the sperm, demonstrating, A, that you can get ruined by it, but as little as 3 months on smoking, you can resurrect a much more competent sperm from a DNA perspective. And of course, that's where the genetics are, less fragmentation. We are now seeing data upon data now of sperm quality and the chromosomal ploidy or aneuploidy as well as euploidy of the embryo. So we're beginning to ask the question, what is it about the sperm that's affecting, if it does provide 50% of the genetic complement of the growing fetus, can we modulate that and somehow improve embryo development as well as one healthy baby? I think the issue we have is the moment you study sperm, you can't use it. So if you test the sperm for its DNA, that sperm can't be used, it's destroyed. Whereas if you take some cells from the embryo and test its DNA, you're just taking a few cells and the embryo continues. And that's the same story for the egg. So we're always, we have to make an assumption, can we make a better egg and sperm? There's enough evidence now piling up which suggests that that is the case, certainly for eggs. I mean, I used to have posters in my room of eggs from women who smoked. They are horrible looking. They're really, and my nurses made me take them down because I was scaring the patients. But I don't doubt that had we had pictures of the sperm, because it's much smaller, it's hard to see, or DNA studies of the sperm, we would see that same impact of smoking, which is pretty easy to see. But that, that doesn't apply to any and all potential toxins. So yes, men need. Now, can we get them to the acupuncturist? Some practices, I know in the A form, some practices will not see the woman without seeing the man. I wish that were the case most places, but I don't think that demand. I think that's a luxury of that practice, and not something that would survive in a setting in which they didn't have excess amount of patients to dispose of. Because in a way, it's throwing away the baby with the bathwater. So we don't demand it, we encourage it. We've now, Dr. Diane for dinner with Eastman's Acupuncture is now providing coupons so that the husband can come along, for a significantly discounted fee just to get them in there because they benefit. Because the thing about traditional Chinese medicine and lifestyle changes, yes, it helps fertility, but they sleep better, have stronger erections, better libidos. Their energy at work is better. They're less depressed. They're better functioning at work. They have less issues with stress. So there's so many non-fertile reasons to do it. I am encouraging anyone who's interested to contact me regarding doing some research projects where we can actually look at the impact of traditional Chinese medicine in men on the outcomes now that we can do genetic testing. And since I do so much genetic testing, we can actually look at those results pretty easily.
Excellent. And, so from here, the recommendations are, one is we need research. So hopefully we can get some people together to do some research. And then it's that recommendation. In our practice, it's interesting. We'll see the woman come in. And as I mentioned, I started in 2000. Between 2000 to 2019, I have to say the men are much more involved. They're still not involved enough compared to the women, especially when it's a diagnosis of male factor. But what we have found is if the woman is the alpha in the relationship, has say or is the say in the relationship, then the men will come for treatment, or at least we've put together a supplement package for men that they can do. Because the good news about men and the bad news is, the good news is they're easy to treat. They respond well because they're always making new sperm. The bad news is they don't come, right? And so often we just say, here's a good antioxidant therapy. We go over diet and lifestyle in the hot tubs, and we let them know that if they do this, it could benefit them. It's not invasive. It's not overly costly either. And so it's kind of an easy thing. Sometimes the answer is, oh, my husband won't take vitamins, or my husband's not interested. So what can we do? We leave that, right? Maybe that couple needs more relationship counseling versus acupuncture or supplements, since that's the way that relationship works. A lot of them actually, where the woman is involved or has a say in the relationship, the men take it. And it's just a funny story, because I know the listeners like this. I had a couple, they were 40, and they actually came in just for fertility optimization. They weren't aware that they had infertility issues. However, they wanted just to do what they can before they have a child. Since they were 40 and they're older, they wanted to make sure they did everything they can to help with that health blueprint. This is many years ago, so this is like, she was really ahead of her time. And she wanted her husband to come. So I saw her 2 or 3 times, and then her husband came in, and she follows right after him. So her husband has her consult. I recommend some acupuncture for him. He had some back pain and sleep issues, and I recommend some basic supplements. He leaves, and she comes in, and she goes, how did it go? I said, I think it went fine. And she goes, did he rebook? Did he pick up supplements? And I said, no, he said he wasn't interested. She goes, 1 second. She leaves. He was at the elevator in the hallway, which we can hear. We hear a little bit of noise. She comes back in, sits down, and says, yeah, he'll be booking those appointments, and he'll be picking up those supplements. So those are the men that we get to treat when that's the type of wife they have. Otherwise, we don't see them.
Well, I want to mention a couple of things that I think, since this is about males. There is a misunderstanding, and I'm sure Dr. Paul Turek talks about this, that somehow testosterone supplementation improves fertility. And so, if you haven't read the news, and you should, testosterone is a great way to become sterile. Temporarily sterile, but sterile. So yes, because there's this misunderstanding of how many times you have intercourse with fertility, that's not fertility, that's libido and recreation. So if your husband partner is taking testosterone supplementation, it is likely, if not presumed, he will have very poor sperm parameters. The hardest thing for a man to do, though, when asked to get off testosterone, they realize how important testosterone is in their own vigor as men and in their lives. So, although I don't know much about how traditional Chinese medicine can help, but there are fertility medicines, Clomid in particular, letrozole maybe, that could enhance testosterone production in the body, in vivo, without impacting negatively the fertility potential of the male. So first and foremost, get off the testosterone if you're trying to have a baby. And it's temporary. Or after you get off the testosterone, freeze 3 or 4 samples of sperm, get back on the testosterone, now you have the sperm available. Secondly, and this is the canary in the mine, what Dr. Turek is talking about is many times men with significant male factor may have concomitant risks for testicular cancer or other cardiovascular problems. So it's not simply fertility. And I've never believed myself as only a fertility doctor. I'm a physician. I'm there to look at everything. I've found cancers in patients and certainly other things because you have to open your eyes. But it is also critical for the couples to understand that even if they're successful in procreating and making a child, that husband or partner with a significant male factor should see a urologist for ongoing care because they are at higher risk for testicular cancer and other issues. So just sort of closing the circle on what you mentioned with Dr. Turek, who, by the way, is an amazing speaker and usually is at the Integrated Fertility Symposium in Vancouver and a good friend. It is critical that all of health is involved with the males, not only their fertility. I sound like an acupuncturist. I don't know what happened.
So again, for more information, check out Reproductive Medicine Fertility Centers in Colorado Springs, Colorado. And then Diane Credenda is a fellow of the American Board of Oriental Reproductive Medicine, also in Colorado Springs, Colorado.